Story 1. It was not me but my mother. I was there to hear it. 2 years after doctors suspected pancreatic or liver cancer and tests showed she did not have either. She was assigned a new primary care doctor who called her in for a routine checkup. The new doctor walked in and said, "I am Dr. So-and-so, and honestly, I do not really want you on my service since you have not sought treatment for your lung cancer." That was verbatim. It was not the most humane way to learn she had lung cancer. It turned out the previous doctor, 2 years earlier, had diagnosed lung cancer after pancreatic cancer was ruled out, but had never told my mother or referred her for a biopsy or treatment. She ended up receiving an advanced radiation treatment that exceeded her insurance coverage when the system tried to correct the error. The treatment was less effective than it might have been, and she died 2 years later. Medical professionals can be negligent and uncaring. Story 2. Aptly named Dr. Richard Head, I had my first urinary tract infection that progressed to a kidney infection. He told my stepmom it was called honeymoon disease and said I was probably having a lot of sex and not being clean. It turned out I have a genetic defect in my ureters and one kidney, so I am more likely to get a kidney infection if I hold my urine. My dad did not stop on a long car ride of 5 hours, and I developed an infection. After the doctor said that, my dad beat me severely that night. I was 13. Story 3. I went to see an endocrinologist for the first time. He said, "You are too young to have diabetes." I was an 18-year-old looking for a new doctor because my pediatrician would no longer see me. I had been diagnosed with type 1 diabetes at age 15 in 1992. At the time, type 1 diabetes was still called juvenile diabetes, as if I needed to be a child to get that diagnosis. I walked out of the appointment and found a different doctor. Story 4. I went to a doctor for antidepressants and he told me that it is all just in my head. Obviously, my brain is not working correctly. I know that, and that is why I want medication. Story 5. When I was 19 and on Accutane, my dermatologist asked me what I was using for birth control. I told him abstinence. He said, "You know that means you cannot go to a frat party, get drunk, and have sex with a stranger, right?" Right. Story 6. It was a troubling situation. My doctor had Bibles in the waiting room and Bible verses on the wall, which may be comforting to some. My partner was reluctant to find her own doctor for a complaint. Her belly felt hard. I told her she needed to get it looked at. She made an appointment with my doctor. He told her she looked healthy. When I asked if he had felt her abdomen, he said no. I felt he was not comfortable treating women. Long story short, we moved, found female doctors, and they took her seriously. She had uterine cancer that eventually metastasized. She died within 8 months. Story 7. I flatlined during surgery to have my fallopian tubes tied. After cardiopulmonary resuscitation and defibrillator paddles, I woke up in the intensive care unit with the procedure not completed. A new nurse said that was God's way of telling me I should have children. By killing me? I screamed, and I told her to get out of my room and never come back. Then I reported her. Story 8. I had bunion correction surgery, and at my final postoperative appointment my doctor said, "You really need to get some scar cream. You are never going to find a husband with a scar like that. First of all, sir, you made it. Second, it is a fucking scar." Story 9. I came in for a medical abortion after being raped and was told by the doctor that abortion is not birth control. No, obviously, this was not exactly on my bingo card of life, lady. Story 10. I had just graduated with my Bachelor of Science in nursing. My doctor looked at me and said, "You're too old to have graduated from anything." I never went back. Story 11. I told a male doctor during a smear test that the speculum was not positioned correctly and was hurting. He said, "Do not be silly. Smear tests do not hurt." Story 12. I was waiting to receive radioactive iodine for thyroid cancer. I had a blood test every day for 8 days leading up to my dose. I was exhausted and in a lot of pain. Then he refused to give it to me because I needed to clear a pregnancy blood test. I told him I could not even walk upstairs and had not had sex in months. So becoming pregnant in the last 24 hours was impossible. He said he did not believe me and that my word was not enough. He did not want to risk a lawsuit if I harmed a non-existent pregnancy with radioactive iodine, despite the waivers I had signed releasing the hospital from responsibility. My mother had to wheel me across the hospital for another blood draw. A staff member said I looked like a junkie. I have cancer. I blacked out during the blood draw. When I returned, I waited another 45 minutes for him to come back from his lunch break. It turned out that because of previous cancers, I am completely sterile. I hope that doctor rots. Story 13. A gastroenterologist asked me if I consumed alcohol. I said no, and he did not believe me. I was only 18. Not all 18-year-olds drink. Story 14. The doctor who had just diagnosed my 18-month-old son with autism and told me he would be institutionalized by age 10 came back into the room and asked why I looked so upset. Story 15. I have slipped discs in my lower back, compressed discs, bone spurs, and osteoarthritis in my neck, along with sciatica in my hip and severe foot problems. My doctor sent me to an orthopedist for pain management and recommendations. The orthopedist walked in and, before I said a word, said I was not getting surgery. He said I was just old 51 and needed to suck it up. I went to my car and cried. I called my doctor and her nurse was horrified. The doctor referred me to another orthopedic clinic. My new appointment is this Thursday. Story 16. Oh, your face is so pimpled, he said. That's why I am here, sir, to treat it. But that comment was rude. Story 17. You are too young to have heart problems. Come back when it gets worse. I went to a different doctor and was diagnosed with supraventricular tachycardia. I may need heart surgery if the condition worsens, so thanks, doctor. Story 18. I went to him with a complaint and he said I was over 70 and no one really cared. Story 19. I have had troublesome skin since puberty. When I was 50, I went to a dermatologist because of a severe breakout on my chest and back. The doctor told me I was too old to worry about it. Story 20. I went to my general practitioner asking for a sexually transmitted infection panel. He immediately scolded me about military wives, saying that as soon as their husbands are away they start being unfaithful. I had found out the day before that my then husband had been having unprotected sex with a female soldier at his base for the past 6 months, and then he came home and had unprotected sex with me. The joke was on the doctor. He contracted mononucleosis not long after and could not see patients for 6 months. Story 21. The National Health Service would rather be helping people with heart problems and other real issues than people like you. I went in with severe depression and came out feeling even worse and completely helpless. Story 22. I experienced a ruptured fallopian tube from an ectopic pregnancy and underwent emergency surgery to remove the non-viable pregnancy and the ruptured tube. I was placed in the labor and delivery ward to recover. The attending doctor told me the next morning that I would have been a terrible mother, because I did not know I was pregnant. Ectopic pregnancies are not viable and often do not cause the regular pregnancy symptoms, so I did not recognize the warning signs until it was too late. I told him to leave my room and reported him. You cannot be on a labor and delivery ward saying such things to patients. Story 23. She performed a full-body examination and giggled at a physical abnormality. I posted a review about her on Yelp and never returned. Story 24. I have hypermobile Ehlers-Danlos syndrome. My first serious injury was at 13, but I was not diagnosed until I was 26. Because my dislocation popped out and immediately went back in, the doctor did not believe I had dislocated it. When arthritis developed, I sought care repeatedly for knee pain and was told I was being dramatic, that I was too young to be in pain, or that there had never been an injury. Once, the doctor wrote a referral to a psychiatrist and told my grandmother and me that I needed to address my attention-seeking behaviors. I was a 15-year-old who had never received proper treatment for a knee dislocation and had developed arthritis. Story 25. I, an 18-year-old gay man, went for my first routine sexually transmitted infection check. As the nurse prepared to swab me, she said, "I would not have to do this if you had normal sex." Story 26. Not much was said, but when I was 17 I went to the gynecologist, who was a man, to get an intrauterine device. That was the day I learned I had an extremely sensitive cervix and screamed in pain throughout the procedure. He mocked my screams, and I will never again see a male gynecologist. Story 27. Can we get someone with more experience in here? I was attempting to place a catheter in a patient who was under anesthesia and had a urethral stricture so severe that a child-sized catheter would not pass, not an enlarged prostate. I tried multiple sizes until I felt it was unsafe to continue because I could have injured the patient. The nurse who came in after me had only graduated that year. I let her try, and she also could not insert the catheter. There was no urologist on staff, so we could not call one. The charge nurse attempted, then wanted the spine surgeon to insert a suprapubic catheter. He rightly refused. Ultimately, the case was cancelled. I still feel uncomfortable when I think about it and about that person being so dismissive of my skills and knowledge. I also wonder how the patient urinated at home. It must have been like a power washer. Story 28. Don't come back until you're screaming and dying on the floor, said the emergency room doctor who refused to admit me for severe abdominal pain and nausea when I was 12. She then said that girls are always so dramatic and faking things at that age. Fast forward 6 years later, I found out I have endometriosis, and that was my first flare-up. Story 29. I have something I could prescribe that will save your life, but you cannot afford it. Please come back when you can. Story 30. When I was younger, I received makeup on prescription because I had severe rosacea that made my skin look as if I had been burned. When I went in for an unrelated issue, the doctor was looking at my notes and said he could not believe I was getting makeup for free. He added that his wife would be jealous because she had to pay for hers. He was a very unpleasant doctor. He did not mean it as a joke. He was seriously complaining and even threatened to stop prescribing it. Story 31. My mom once took me to a fill-in doctor because my regular doctor was closed that day. I was very wheezy and coughing a lot, and my mom knew immediately that I had bronchitis, which I got every winter. The doctor took one look at me and then at my mother and said, "Why are you so skinny while your daughter looks fat?" My mother, who had been losing a lot of weight because of her own health issues, was furious. She insulted the doctor and kept me home until the next day when my regular doctor was open. Story 32. Despite 5 years of stabbing pain and a poor quality of life, he refused to perform a hysterectomy because my future husband might want children. Story 33. I'm sure a blind monkey could fold towels better than you. To clarify, my wife is a doctor. Story 34. I was told my mother did it to herself when she died of a heart attack. She was one of the healthiest people I knew. Story 35. Through tears, I told her that my depression was a factor in my difficulties managing my chronic medical condition. She replied, "I don't know why you're crying. There are people who have it worse." Story 36. I highly doubt someone would assault you based on your appearance. I was assaulted and developed heart failure and cardiomyopathy, an enlarged heart, due to an infection I contracted during the assault, but apparently I wasn't pretty enough to fit the type of person a man would choose to attack. They went on to say that because I was not a size 0 or a cheerleader, I was not worth a modicum of respect or empathy. This incident changed the whole trajectory of my life. I could say something worse, but it would only make me feel worse, so I'll leave it at that. Story 37. Are you sure you did not ask for it? 1974 was a different time. Story 38. It is your fault the medication is not working. You just need to try harder. I have no idea what I was supposed to do about that. Swallow harder? Wish really hard? Story 39. I tried to talk to a psychiatrist about attention deficit hyperactivity disorder after another psychiatrist suggested I might have it just before I moved. The psychiatrist called the pharmacy in front of me and asked the pharmacist why I had only been prescribed a stimulant once. They assumed I was seeking drugs. It was awful, and it took me several more years to receive proper treatment for the attention deficit hyperactivity disorder I had all along. Story 40. Just pull yourself together. After a fracture, I was waiting to get a computed tomography scan. I was also told I was not sick. Story 41. My general practitioner prescribed a thyroid medication for my chronically low thyroid. My symptoms only got worse. At the next office visit, I asked if we could adjust the dose or try another medication. He angrily agreed to increase the dosage but warned it would be the last time he would do it. A few months later, I came back for a recheck. Although I arrived early, I was never called to see the doctor. I sat in the waiting room for hours, watching people be seen and leave. When I asked about my appointment, they told me to just wait. The doctor seemed intent on making me angry enough to leave. I decided to stay. Near closing time, the doctor finally came into the waiting room with my chart and sat down next to me. He began talking as though this were a normal exam with no check of vital signs, no blood draw, nothing. I asked what was going on. He said something like, "I'm tired of arguing with you about these thyroid medications," and indicated that this was all the time and attention I would get that day. As I had suspected, I lost my temper. I told him he was a terrible doctor and that it was my last visit. I was very angry, and I think I may have said something like, "Rip your head off." I then found a competent female endocrinologist who correctly diagnosed my Hashimoto's thyroiditis and told me my previous doctor had given me the wrong treatment. She prescribed the right medications, and now I am fine. I am on medication for life but feeling great. I am so tired of marginally competent male doctors who treat female patients like brainless morons. When we educate ourselves about our illnesses and ask questions, we are often met with anger and hostility. Our symptoms are written off as attention-seeking. My husband never has these problems. A number of my female acquaintances, and I seem to encounter this frequently, keeps me from going to any doctor unless I absolutely have to. I wonder if they teach this in medical school, or if the types of men who go into medicine are simply jerks. Story 42. I was approved to be sterilized by my general practitioner. The surgeon said no because I might meet a man one day who wanted children. I was already married. My husband was fully supportive of the choice. I said, "To be clear, you are telling me no, because of the feelings of a man I have never met, who may or may not even exist." She denied that, and when I asked her to clarify because that was exactly how it sounded to me, she had nothing, just pursed lips and a recommendation for an intrauterine device. During insertion of the intrauterine device, I was told there would be a bit of discomfort and a slight pinch. It was agonizing and took longer than usual. She said my cervix was very deep and I had a narrow vaginal canal. That does not make sense. It was narrow because I was not relaxed. I did not appreciate that she blamed her difficulties on my body. Story 43. At 35, I was given a long speech that my time was running out and that if I wanted to have a baby, I should act as soon as possible. I know this. Story 44. They told me they could not keep treating me every time I was sick. A week later, I was on my deathbed. The local hospital also turned me away. I had to go to urgent care with an extremely high temperature, so they would call the hospital. Story 45. She laughed at me and asked if I had never had cramps before. I later learned I have multiple benign tumors. I am now struggling with fibroids that the doctors never acknowledged during that visit. May she suffer as I have. Story 46. Me. I have a long list of symptoms, and unless I am literally starving, meaning not eating anything at all, I just keep gaining weight. Please test my thyroid. Him? No. That seems unnecessary. I bet you are eating a lot and just not wanting to tell me the truth. Lay off the butter and you will lose weight. Story 47. A pediatrician said that the only thing wrong with your son is his mother. My youngest son died 4 months later from a rare disease. Story 48. Me. I'm having painful symptoms related to my condition. Doctor, no, you are not. Context. She did not believe that my symptoms were related to my condition, even though the same symptoms recurred 5 times during that period. If you are a doctor who does this, fuck you. Do not tell me that what I feel is not real or belittle my pain just because you have a degree. I know my own body. Story 49. I think the rudest thing was when I was a teenager. I had an issue where I fainted a few times a month, usually at school. My doctor would not give me a requisition for blood work. He just said, "It is normal for teenage girls to faint," and did nothing. I was confused because nobody else I knew fainted that often. After a vicious rumor spread at my high school that I was pregnant and therefore fainting, I saw a different doctor who immediately ordered blood tests. They showed that I was anemic. I started taking iron supplements and the fainting stopped. Story 50. Patient believes he is in pain. The dismissiveness of that statement prompted me to find a new doctor who did not treat patients as if everything they said was imagined. Story 51. Being told I need to adjust my attitude when dealing with chronic health issues that have no known cause is unhelpful. As if I could simply choose to be happy. Story 52. Are you in the medical field? I received many comments and questions regarding my early-stage breast cancer treatment, and I went to a different one immediately. Story 53. They called me fat, even though they were fatter than I was. Story 54. I had postpartum depression. My general practitioner said all I needed was a good kick in the pants. I never went back. Story 55. Mental health does not exist. You are not depressed. This was said while I was actively hallucinating and convinced I was becoming a psychopath. My mother agreed with the doctor. No further tests were ordered. Story 56. My pediatrician told me I should not be sad that my friend died, because I am young and can make new friends. Story 57. I went to the emergency room because I had been very sick for a while and did not have a family doctor in the new Canadian province where I had moved. I told the doctor that I had been ill since a few months after moving, and he suggested I return to where I came from, which was not an option for me. Story 58. I ended up in accident and emergency with severe abdominal pain. I was not seen for 15 hours, by which time the pain had eased. I asked for a scan because gallstones were suspected, and the doctor, a Foundation Year 2 doctor with a supervisor, said, "Let's wait and see." I replied that my general practitioner had a wait-and-see attitude and that I had buried my husband 6 weeks earlier. The doctor, "I am not making this up," responded, "Well, that is your problem. You are clearly just hysterical." Her supervising doctor took her to the nurse's station and read her the riot act. I filed an official complaint. I had my gallbladder removed a month later. Story 59. The doctor did not say it to me directly, but he had a pre-med student shadowing him and was rude to her. The doctor, a 50-year-old man, instructed the student, a 30-year-old woman, to take notes while he took my vitals. Afterwards, he asked her to read them back, and when she did, he said, "Good girl." Lost my temper. I told him how dare he speak to a grown woman, who is also pursuing higher education in the medical field, as if she were a pet. I pointed out everything wrong with it. He panicked and backtracked. In the end, he agreed he needed to work on his bedside manner, and I said, "Good boy." She smiled at me. Story 60. I do not know if it was rude, but it was definitely weird and inappropriate. When I was 8, I cut the upper back of my left thigh when someone buried broken glass at the bottom of a slide. The doctor who stitched it did a poor job. It left a large raised scar. He said it would not matter because the only person who would ever see it would be my husband. Story 61. You do not look sick. I had undiagnosed Crohn's disease and recurrent perianal abscesses. Story 62. We have reached the end of what we can do for you medically. Story 63. A gynecologist remarked on how hairy I was. I never went back. Story 64. I was 12 minutes late to an appointment once because of traffic. I was there for a college physical. At the end of the appointment, the doctor asked if there was anything else. I said I wanted to talk about medication for depression. The doctor said, "You were already late. You need to make another appointment for that." He then asked, "Are you okay though?" I laughed at how absurd it was. I was, in fact, not okay, but I told him it was fine. I said he could bill me and that I would find a new doctor. Story 65. I once had a nurse inspect my feet because of diabetes. "Why are your feet like this?" I didn't know. I had just grown wonky toes. She then told me my shoes, socks, and trousers were all wrong. I was in my work uniform. Sensible flat shoes, tapered trousers, and plain socks. I was really glad she didn't want to look at anything else. Nobody expects the diabetes fashion police. Story 66. Then just suffer was what my gynecologist said after I kept refusing to try yet another hormonal birth control. The first 2 had given me horrible side effects. That was her only suggestion for the heavy, painful periods I was experiencing. I finally saw a physician assistant who immediately performed an ultrasound and discovered uterine fibroids that were causing the problem. I had an ablation that pretty much took care of it. I was furious with the first doctor. Story 67. I had my pubic area waxed. When I saw my gynecologist, he asked what had happened to all the hair. Story 68. When I was 12, I broke both my radius and ulna on a skate ramp. I was in the emergency room with my mom, holding my arm in place. The bones were cleanly broken in half. The nurse told me to stop crying because it didn't hurt that much. Story 69. I accompanied my 84-year-old father to his primary care appointment. He had lost 20 pounds without trying, was weak and exhausted, had recently started using my mother's walker, and had swollen feet and lower legs. Because my mother had just died that week, the doctor, a young man in his 30s, did not take any of these physical symptoms seriously. I insisted on imaging because of the weight loss, and the doctor actually laughed at me. 6 weeks later, a neighbor drove him to the practice. He reported the same complaints and was now afraid to drive. The senior doctor told him it was all in his head and told him to drive his car around the block and see how it goes. A week later, I took my father to the emergency room. He had acute heart failure, a complication of acute myeloid leukemia that had been undiagnosed. After 10 days in the small local hospital, I transferred him to a major university hospital several hours away. The doctor's office manager called me because a medical alert system showed he was at that hospital and she wanted to know why. 3 weeks after I took him to the emergency room, he died after only 1 round of chemotherapy. I called the primary care practice. None of the doctors would get on the call with me, so I confronted the office manager. I consulted an attorney who said malpractice cases that fall under personal injury are extremely difficult to prove and that Medicare would be the one to benefit financially. It has been over a year and I am still so fucking pissed. Story 70. I asked to be referred to a psychiatrist, and the doctor said, "What do you expect them to do for you?" I replied, "I don't know. Treat me." Story 71. I am not a doctor, but a dental hygienist asked if I brush my teeth every day. I said yes twice a day and that I floss. She asked if I was sure and questioned me because I had damage to my teeth from a severe temporomandibular joint disorder. Story 72. Not me, but someone else who used to have anorexia recovered and later developed binge eating disorder. The doctor told them to lay off the cakes for a while. Story 73. I came in very sick with a fever and vomiting. The doctor spent no time examining me. He ordered morphine and told staff to give it, then stop. He said my baby had died and that I needed to deal with that and stop seeking pain medication. He gave me those medications and sent me home. I later almost died of sepsis. It was so bad that doctors at a different hospital told my family to say their goodbyes. I was furious. I was not faking. Story 74. She was a nurse. I went in for a review of my antipsychotic medication. I was in a very fragile state and she was aware of that. She told me I was morbidly obese and that I needed to lose weight. She could have been honest about my weight, but she was downright nasty about it. The antipsychotic medication had caused me to gain weight, and I had previously had an eating disorder, which she also knew. She weighed about twice as much as I did. Story 75. It was not what she said, but she charged me for a smoking cessation talk while wearing a smug grin, insinuating that people smoke more when drinking. Story 76. They told my mother and me that my suicide attempt was just a cry for attention. Story 77. A doctor told me that asking to see a dermatologist was a middle-class woman wasting the National Health Service's money. The word white was implied as well. My mother had skin cancer at 26, and a maternal uncle and aunt died at 38 and 45, respectively. The dermatologist I eventually saw was horrified that I had not been seen earlier. I had 4 moles removed within a month. Story 78. I was 20 and went to my doctor to get on birth control because I had started having sex with my boyfriend, and she told me, "Your mother must be so disappointed." I never went back. Story 79. Not my story, but this stuck in my head. My Muslim coworker was told that her menstrual cramps were so severe she fainted because she was still a virgin, and that the pain would change after she had sex. Her female doctor told her this for years. A visiting doctor suspected otherwise, sent her for tests, and diagnosed endometriosis. It was eye-opening. I was young and did not realize how far prejudice could spread, even among people who had taken oaths to care for others. Story 80. This was not rude, but it should have been. I was diagnosed with sleep apnea and underwent a $1,100 sleep study and used several $600 machines to force air down my throat while I slept, and none of them worked for me. After I lost 20 pounds, the problem went away. I asked my doctor why she had not simply told me that losing about 20 pounds might resolve it, and she said, "Patients do not want to hear that." Story 81. As a transgender man, an eye doctor once saw in my chart that I was trans. I normally would not mention it to an eye doctor because it has nothing to do with the visit, and he flatly asked me what genitalia I had. I was astounded and did not report him. I wish I could remember his name because that was unacceptable. This happened about 15 years ago. Story 82. You just need to deal with the pain because it's your fault you had so many surgeries. Context. I had 4 abdominal surgeries in 4 years. 3 were for gallstones and biliary colic. The first 2 were laparoscopic and the last 2 were open. Each scar is about 12 inches long. Even after the 4th surgery, I kept experiencing colic. I was asking for help to try to figure out why so it would stop, because it had become a daily problem and was affecting my work and my life. I fired him and, with the help of my new doctor, we finally discovered it was coffee. In the years since, magnetic resonance imaging confirmed that I am still forming stones. The difference is that I can now pass them, thanks to the 3rd surgery, without ending up in the hospital with pancreatitis and jaundice from a complete blockage, unlike before the surgeries. In summary, the doctor told me the colic was all my fault for having life-saving surgeries. Story 83. Not necessarily rude, but my female gynecologist told me that G-spots are not real. A psychiatrist said I could not possibly have attention deficit hyperactivity disorder because I have 2 master's degrees, which was an extremely difficult time for my mental health. When I was a teenager, a nurse taking my blood told me to hold your hand loose like you're gay, and giggled. Story 84. They said my pregnancy troubles were Eve's fault and that it was just a woman's lot in life. That was the response to nearly every complaint. I had constant heartburn. No medication was offered. My gallbladder was removed 3 weeks after the birth. I had terrible back pain. I was told to quit working when I was 5 months pregnant. No physical therapy was offered for these and other minor problems. My second pregnancy with another doctor was completely different. Story 85. I might have blood cancer or I might be fine, but I'm not going to find out. I didn't have a job with health insurance or enough money to pay for the necessary tests, and treatment would be unaffordable if it were something serious. I went to a free clinic for low-income people because my job paid minimum wage and had no benefits. Joke's on you, Dr. Asshole. It's been long enough that if it were something serious I would be dead by now, so I've got my answer for free. Story 86. We only issue knee braces to soldiers who are actually injured. This was after seeing that my leg was not broken on a radiograph. The fucking Sergeant Shitface refused to believe that only bones show on a radiograph and that my leg could be otherwise injured. I should have fought for a medical discharge and sued the military entrance processing station for not excluding me for a condition I did not know I had. Story 87. I was at my appointment to remove my intrauterine device because of many problems, and the T-shaped part of it would not retract. It got stuck in my cervix and my primary doctor did not want to keep pulling because it was causing me pain. He called the on-call gynecologist, but no one could find him. I waited for over an hour. I was being wheeled to the operating room to be sedated for removal when the gynecologist arrived. It turned out he had slept in his car and no one could find him. He looked at the device and decided to just rip it out. Without warning, I screamed. He showed it to me and said, "That wasn't so bad." I screamed at him to shove it up his penis and rip it out himself, and then he could tell me. He asked if I wanted it. I told him to fuck off. He then left while I was still in the stirrups. My primary doctor and the nurse were so shocked that they filed complaints. I also filed one but was told he did nothing wrong. I developed an infection because he turned my cervix inside out, which led to a trip to the emergency room. I worked at this facility. Military medicine is great. Story 88. In 2001, a gynecologist told me I might have adenomyosis, so I went home and looked it up on the internet. I learned that the only way to confirm it was to remove the uterus and test the tissue. When I returned for a follow-up, thinking a hysterectomy was imminent, I asked for more information and mentioned I had done some research online. He rolled his eyes and said in a cold, haughty, disgusted tone, "Everybody thinks they're an authority now because they can look it up on the internet." I replied, "Did I say I was an authority? I just asked you for more information," and called him an entitled prick. I stopped seeing that doctor immediately after the surgery. Story 89. In the past, people treated tiredness and muscle pain with labor therapy. Go work at a factory and your problems will go away quickly. It turned out to be depression, which is not cured by forcing someone to work in a factory. By the way, I was 16 at the time. Story 90. I had an intrauterine device placed in 2019. It was the most painful experience of my life. I had it removed 2 months later, and the doctor said, "If you cannot handle this, do not even bother getting pregnant. Childbirth is much worse." Turned out I have a bicornuate uterus and the device was stabbing the uterine horn. The provider was female at Keck Hospital of the University of Southern California, and I was appalled. She had skipped the ultrasound because of her ego, which resulted in the worst few months of my life. Story 91. I don't know what to tell you. You can take a minute to get it together and get dressed. Don't forget to stop at the checkout desk and pay on your way out. Said to me by a female doctor at a Planned Parenthood clinic in a disgustingly flaming red state. Context. I'd come back in to get results from some previous tests, my Papa Nicolau test, and to refill my birth control. I was also in the thick of a violently abusive relationship. The test results had come back in such a way that the doctor felt that continuing my current birth control would be detrimental to my health. I began to panic. I was trying to refill my birth control pills but knew there were many other options, so I asked her what other method I could use. She said the only thing she would recommend was condoms. The panic kicked into high gear and I began crying. I told her that my boyfriend refused to wear condoms. I begged her, asking if I could get the shot, the ring, an implant, any method of birth control that I could be responsible for. She responded with something like, "Well, if he refuses condoms, tell him he gets no sex." I was sobbing when I told her that I was not allowed to refuse sex with him. That's when she looked at me, saw I was losing it, half naked, wrapped in a paper gown on the exam table, and said those words while walking out the door. I finally escaped him, but not before 2 abortions, whose trauma I still have not worked through. Please save your judgment. I would rather die than subject my child to the next generation of that family's cycle of abuse or bind myself to it permanently. He would have killed me or I would have killed myself. Somehow, sadly, that never falls under the category of to save the life of the mother. I will never forgive that doctor. I was too young and traumatized to know to report her. I might not remember her name, but I guarantee the devil will when he gets her eternal place ready. She not only caused 2 abortions but also caused a lifelong, crippling fear of doctors. I still have yet to fully disclose my medical history to any that followed. I am 47 years old and cannot even make a dentist appointment without my mother harping on me for months. The only 2 medical professionals I trust are my chiropractor and my dog's veterinarian. Edited to add. This is in no way meant to imply that I do not fully support Planned Parenthood. I believe now, just as I did then, that they do very important, worthwhile work. I want to state openly that that doctor should not have been working there or in any occupation that involved contact with another person. Not all angels have wings, and not all devils have horns. Story 92. I've been sober for 10 years. At a new obstetrician-gynecologist appointment, during intake the nurse asked how many drinks I had per week. I said 0, and she asked again, "No, really, how many drinks per week?" I told her I was sober and do not drink. The doctor said, "We only offer obstetrics and gynecology services, but if you are struggling with alcohol, I can refer you to a specialist." I told him I had been sober for 10 years and that I was fine. Then I got up and left. It was demoralizing to be treated that way. Story 93. At the beginning of menopause, which coincided with the coronavirus pandemic, I gained about 20 pounds in roughly a year and a half. At my annual gynecologist appointment, he flippantly said that everyone had gained weight from sitting around during the past year, which could not have been further from the truth. I worked in an office 5 days a week for about 10 hours a day, still got my daily steps and ate sensibly. I left his practice immediately. Story 94. Neosporin has a really good marketing strategy, I said in a condescending tone. I had a road rash burn that developed blisters 2 weeks after the skin healed. I had used a small amount of Neosporin while my hand was bandaged to keep the gauze from sticking to the wound, but after the first layer of skin mostly healed, I stopped using it. The nurse practitioner was convinced the blisters were from recent Neosporin use even after I told her I had not used it in the 2 weeks before coming in. She would not give up on the idea. Even after I dropped the topic, she continued to bring it up during other parts of the exam. At the end of the session, when I asked about blister care while on steroids, she brought up Neosporin again and told me to just use my prescribed steroids as if I did not know the two are not interchangeable. That was not the worst part of the session, but it was what I remembered. I also had a severe knee injury that she clearly thought I was faking even though I could not bend my knee for months. My knee still cannot bend all the way nearly a year later. Story 95. I was diagnosed in 2020 with stage 4 cancer that had a life expectancy of 2 to 4 years. This year, on the 5th anniversary of my diagnosis, I told my doctor. He replied, "You should have been dead by now." Story 96. My general practitioner said, "People who work do not have mental health problems." After my manager insisted I make an appointment and helped me write a list of the issues I was having, it emerged later that I had already been diagnosed with a personality disorder, major depressive disorder, and severe anxiety. It was in my records at the time he said it. I did not discover this until it became possible to access my medical record online 15 years later. I have since been diagnosed with autism and attention deficit hyperactivity disorder and probably would not have been so mentally ill if I had had support for those. Story 97. I am a pharmacist, so I often speak with rude doctors. Many tell me not to question prescriptions and to fill them blindly. On more than one occasion, a doctor told me to fill a prescription that could have killed a patient. Doctors are not as infallible as people would like to believe. Story 98. It was not a doctor but a nurse during a 10-day epilepsy monitoring stay in the hospital. The nurse walked in and asked, "So level with me, how much do you drink?" I told him to fuck off and that I had been sober for almost 2 years. Story 99. When I was pregnant with my son, the doctor asked where the father was. I said he was not around because he was a bad person. The doctor then said, "Maybe you are bad too because you were with him." I left my son's father after he strangled me while I was pregnant. He was also having an affair with our next-door neighbor, whom he later married. Story 100. A doctor once berated me for drinking soda and said it was the cause of my chronic pain. It wasn't. I have arthritis and other health issues. At a follow-up appointment, she asked, "You still drinking soda?" I did not answer right away, and she swatted my leg and told me to quit. I said, "Yes, I drink soda. I'm leaving." I never went back and found a new doctor who is excellent. Story 101. A therapist told me that I should not expect to be a grandmother, since my sons, who were in their mid-teens at the time, had autism and were never going to leave my house. It has proven true, but the callousness in the way he said it truly hurt. Story 102. I had an accident. I went to the emergency room early in the morning because of it. Possible trigger. A piece of red-hot metal from welding got in my ear. I went instantly deaf, vomited, and could not stand. The inside of my ear and head felt burned. The pain was unimaginable. Felt like raw flesh and my eardrum was gone. I went to get checked and to have my eardrum examined. The doctor said there was no damage. I told him that if I closed my nose I could puff air out of my ear. He dismissed it, gave no pain medication and no treatment. He clearly labeled me as a drug seeker and said something like, "Honestly, this is no reason to get any painkiller at all. There is a bit of a rash and some swelling. But this is an emergency room and not a place to hand out pills or narcotics. I don't like this kind of attitude here. Man up, go to a doctor tomorrow and maybe get some cream. If the pain is so bad, you can buy some ibuprofen at the 24-hour pharmacy." He gave me an insulting letter for my family doctor and sent me away despite my begging because the pain was killing me. My girlfriend called the university hospital in the next town. They woke a specialist who was at home and not on call. It was 4 in the morning. He said he could see me between 5 and 5:30. My girlfriend drove me because I was wrecked and had already told him details over the phone. He looked in my ear and freaked out. He showed me pictures of what was left of my eardrum and the other damage and was in disbelief that I had been sent home from the emergency room. He asked which emergency room I had been to and was even more shocked when I showed him the letter, because he knew the doctor who had treated me. He called that doctor and asked if he was out of his mind. It was not a friendly call. The pain was unbearable. That same day, I was prescribed immediate-release oxycodone for 2 to 3 weeks and daily liquid antibiotics to be administered into my ear for at least 2 weeks because the inflammation could have been fatal. I had to visit the doctor once or twice a day for treatment. Because of the circumstances, the specialist showed my girlfriend how to change the dressing twice a day, gave us a 200 to 250 milliliter bottle of the antibiotic to keep refrigerated, a large quantity of Becton Dickinson Eclipse safety needles, disinfectant, medical cotton wool, and other supplies because driving to his practice would have been horrible for me. I spent the next 3 weeks in bed or on the sofa, visited the doctor each week, and despite the oxycodone I was in agony and unable to do anything. It was a horrible nightmare. There were legal consequences, not just a slap on the wrist for the emergency room doctor. I received a written apology and other measures intended to prevent me from suing, but of course I did. This has caused medical post-traumatic stress. I have another similar story, but that is too much to share. This is what happened. Story 103. In my final year at university, I was sitting final exams and feeling very stressed. One night I had difficulty breathing and was really struggling. My dad took me to the accident and emergency department. It turned out to be a panic attack. They advised me to make an appointment with my general practitioner for help. They were very kind. I went to my general practitioner and told him I had visited the accident and emergency department because I thought I was dying. He scolded me for going to accident and emergency and said they would now charge his practice for the visit. He was rude and raised his voice at me. Good thing my parents pay their taxes so they can use the accident and emergency department if they need it, doctor. I was young and I accepted it then. I would stand up to him now. Story 104. You need to lose weight, you are obese. Physical examination and laboratory tests are normal. I powerlift, which you can plainly see. Incorporate cardiovascular exercise such as treadmill, elliptical, and stair climber, and practice healthy eating. When I told my doctor and pointed out the limitations of body mass index while noting that I am a pharmacist, the doctor was too arrogant to admit error. He is no longer my doctor. Story 105. I had an appointment with an older male general practitioner about depression. He diagnosed me based on whether I would feel happier if Brad Pitt rode in on a horse. Another general practitioner told me it could all be fixed if I read a few books. Story 106. I guess the one time my doctor told me, "You have nothing. It's all in your head." I thought I was going crazy. He should have said, "I don't know. I had and still have a chronic disease." Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.